Hello. How are you? Welcome. I'm Nurse Matt, and on my planet, you were just kidnapped. And we want to make sure that you're in perfect shape. Now, I'm going to ask you a few questions before we begin. Can you please state your first and last name? And do you remember your date of birth? Okay. I'm going to ask you a few questions just to make sure that your memory is still intact. Do you remember what you had for breakfast this morning? Okay. Cereals, milk. And do you remember if you took your medicine this morning? Okay. And do you remember injuring yourself? No? That's good. Okay. Good. Alright, I'm going to go ahead and take your blood pressure. Now, you would think that on this new planet we should have automatic blood pressure cuffs and machines, but we do not. We are very ancient, and we really believe in old school. Now, can you please uncross your feet for me? Thank you. Oh, wow. Your blood pressure is very elevated. Now, there's no reason to be scared, okay? We are a very peaceful species, and we really just want the best for you. Okay, his blood pressure is spiked 180/75. I'll give me a little bit stat. Thank you. Now I'm just going to go ahead and give you some medication through your board here that we inserted while you were sleeping, and I'm going to just make sure that I'm slowly administering your antiarrhythmic medication. Okay. And you're going to feel kind of flushed. It's going to start in a few moments. Okay. Let's go ahead and check your oxygenation. I'm going to put this on your index finger. And can you take a deep breath in and breathe out? Good. Excellent. Okay, so that was good. 98 percentile in room air. We need to check his pupil reaction. And just look at my light, and now look at my nose. Look at the light, and now look at my nose. Again, look at the light, and follow the light with your eyes only. Don't move your head. Good. And again, look at the light. Okay, that's good. When was the last time you had something to drink? Okay, so it's been a while. We definitely need you very well hydrated. And I'm going to insert just one drop on your tongue. This will definitely give you 24-hour hydration. Okay, give you a little bit more, so that should hold you for another 2 days. Okay, we administer nutrition through the nose portal, and I'm going to insert 1 and 2 drops in each nair. So go ahead and breathe in on the count of 3. 1, 2, 3. Good. And one more time. 1, 2, 3. Good. Okay. And I'm going to go ahead and check your facial sensation, just to make sure that everything is still functioning properly. Okay? Can you please tell me where you feel this on your face? That's good. What about now? Okay. And what about now? On your forehead? That's very good. Okay. This is better than the last specimen that we received. What about here? Okay. It's very important for us to encourage our subjects to perform on their first evaluation as properly as possible. So keep on telling me where you feel this. Okay. And now. Good. And now. Good. Okay. On our planet, we listen to your heart through your eyes. So I'm going to need you to close your eyes. Okay? Close your eyes and let me listen to your heart. Good. And again, on your other eye, let me listen to your heart. Keep your eyes closed for me, please. Good. That was very good. Okay, let's go ahead and check your hearing. I'm going to whisper some words in your ears, and I need you to repeat them back. Can you please tell me what I just said? Something wrong with your right ear. What's going on tonight? Why can't you sleep? Okay, can you please tell me what I just said? Very hard to understand me. Well, we learned your language, so for sure I am positive that I can speak your language, and it seems like you can understand me pretty good when I'm speaking softly. Okay, I'm going to perform a sharp or dull test on your face. And this is our final test before we take a final decision. Can you please tell me if you feel sharp or dull? Sharp, dull. That was not sharp. Yes, it is sharp. Okay, good. What about now? Sharp. Okay. Okay. Well, let's go ahead and check your ears now. I'm going to check your tympanic membrane, so very deep inside your ear. This should not be painful at all. I'm going to need you to look that way for me. Can you do that? Okay, good. Tympanic membrane is broad gray. There seems to be some infection in your right ear. Let's go ahead and check your other ear. That doesn't look good. Okay, I'm not going to give you too many explanations. You do not need to know what's going on. I'm going to decline your file. Declined. And very bad news, you can't live on our planet, but you can try again in 30 days. So we're going to send you back to Earth. Goodbye.
Hi, how are you? I'm so sorry about your experience with the aliens from planet Bleep Blorp. They really did a number on you. You were rejected from their planet. This is a species that Earth has identified as hostile. And as such, you were administered some tests that we believe were not all that they seemed. We have information that some of the sharp and dull tests that the aliens from planet Bleep Blorp deliver are actually nerve potions that are there to deconstruct your taste buds. And it's a project that they've been working on for a while. They're a very deceptive alien species. So I'm sorry to say, but before we let you back in to planet Earth, we're going to have to do some checkup tests. We're going to have to just make sure that you are not infected with any bacteria or plague or illness or any kind of sickness that is not native to planet Earth. There's a very high likelihood that there was contamination. You look okay. Let me see your tongue. Okay, your tongue isn't purple, so that's very good. That's one of the biggest symptoms of problems. Okay, so but I'm just going to administer a taste test to start with, and that will give you our first. Okay, so I'm just going to administer a taste test to start with, and that's going to give us the clearest indicator of whether there was a big problem. Okay. Okay, so can you identify this taste? Okay. Oh, blackberries. Okay, very good. Okay, so that's very good. That tells us that your taste buds are intact, which is a really good sign. Okay, I'm just going to administer a couple more taste tests. These are just on a smaller level. So just open your mouth, please. Okay. What was that? Roses, yes. Okay. Okay, very good. So far, the initial phase, our initial assessment is that you do seem healthy. I'm just going to be doing some vitals and going to be taking some samples. We're going to be sending it to the lab for testing just to make sure, okay? Okay. All right. So just relax, okay? I know you've been through a lot. Can I ask, what was it about our planet that you so much wanted to get away from? Okay. Okay. The quality of meat wasn't to your standard. Okay. That's very strange. All right. Okay, I'm so sorry to hear that, but when you eat primarily fast foods, as you indicated, that's what you're going to get. So I would say, anyway, I think we should just move on, okay? You're just, sorry, you're just gonna have to stay on Earth and just deal with our inferior foods, as you call it. Okay, so just take a deep breath for me. Deep breath in. Okay, deep breath in. And hold. Deep breath out. Okay. Deep breath in. And deep breath out. Very good. Okay. Deep breath in. And deep breath out. Okay. And again, deep breath in. And deep breath out. Your heart seems normal so far. I'm going to be listening on the bell side, okay? Same thing. Just deep breath in. And relax. Deep breath out. Okay, very good. Breath in. And out. Very good. Okay, just a few more times. Deep breath in. Alright, and relax. Deep breath out. Okay. Alright, excellent. So your heart seems to be intact and just working very normally. So I'm very happy to see that. You could just give me your finger. I'm going to take your oxygenation, okay? Okay, just relax. Alright, that's 96 percentile of room air. So that is very, very good. Next, I'm just going to be taking your temperature then. Okay. Are you feeling any tingly sensations, numbness? Okay. Or any nausea? Okay, that's good. Alright, that is 98.4 degrees Fahrenheit, so perfect, excellent. Alright, and next I'm just going to be running some tests on your hair. Okay, I'm going to be checking for any lice infections. Okay. Okay, the planet that you were just rejected from, unfortunately, they do have a huge infestation problem. So they have a lot of dangerous little lice. And also what they do is they will implant lice-looking devices in your hair that actually are surveillance devices. Okay, and we want to stay away from that because they like to spy on us. Okay, so I'm going to be doing a very thorough, in-depth check of your hair. Absolutely, okay? So I'm sorry if this tangles. You kind of brought this on yourself. Okay, you brought it on yourself. You shouldn't have applied to be in the other planet. You should have stayed here. Okay. Very good. Okay. Just a second, I think I detect something. Okay. Alright, I believe that what I'm seeing here is just a human lice, which means that you had bad hygiene to begin with. But I'm just gonna take a sample just to be sure so I can send it to the lab. Okay, we're going to be setting this for testing. Okay, I'm just going to take a few more. I'm just going to be brushing through your hair. was just a dirt speck, so that's good. Okay. Alright, hold still. Okay. Interesting here. Okay, we're just going to go over it a few more times and then with the second brush that we have, okay. Just going to be going over with another brush. We're going to be going over your hair. Okay, very good. Okay. Okay, I don't see anything. I don't see anything for me to be worried of. So that's really good. Okay. So next, just going to be applying a cold sensation to your face. I want you to let me know if you feel the cold. Okay? And so say cold if you feel cold. And then tell me what side of your face you feel it on. Okay, we're looking for any form of numbness because that's a sign of an extraterrestrial biological weapon. And we don't want that for you, okay? Good. Good. Very good. Very good. Excellent. Okay. Let's pull sides and cold. Okay. Let's do that again. Okay. Okay, excellent. Okay, that was cold. Yes. Okay. So next I have a healing Thai medicine ball. This is a special ancient concoction native to planet Earth. What we do know is that outside species, if they have contaminated you with a certain substance, you will react in hives to this. Absolutely, if we put it anywhere near your body. So what I'm going to do is I'm going to be, unfortunately, just putting it all along your body, and we're going to know immediately if you break out into hives, if you have been contaminated, okay? And if you haven't, it should feel very relaxing. It should feel very soft and smooth. And the fragrance should be very soothing to you, okay? Okay. Okay. Okay, no hives so far. Okay. Good. Okay, your breathing's normal. It's a very good sign. Okay, just keep breathing deeply. Almost done with this test. any itchiness or swelling? Okay, that's very good. No red sensations. Okay. Excellent. Okay. Okay, so this is an extremely good indicator that you've passed this test. Okay. So what I'd like to do now is, if you don't mind, may I take a seat here? Because we need to run some general checkups on your organs, okay? So I'm going to do some abdominal pulsing, all right, just to make sure that your organs haven't had any negative reactions to your experience in a different stratosphere, okay? So I'm going to be feeling for hardness, any kind of lumps, any kind of enlargement, okay? Just want to make sure that everything is normal, so you can just keep breathing deeply. Don't get overexcited, okay? This is very serious. Okay. Okay, I'm just feeling on the tops of the area. Okay. I'm just feeling right in your, beneath your breastbone and your chest area. So far, everything's really good. Okay. Excellent. Okay. Okay, I feel a little bit. Okay, take a deep breath. Okay, that was just an air bubble. You're fine. You're fine. Okay, I don't feel any liver enlargements. Your organs feel like a very nice size. Okay. Okay. I'm just gonna palpate. Palpating and percussing. Okay. Very good. Okay. Okay. Hold still. Very good. Okay. All right. Excellent. All right. I'm just feeling the area, your lymph node area. Okay. Good. So, very, very fortunately, your organs feel normal. Everything feels extremely normal here. Okay. But what we want to do is check for swelling in the legs and feet. Okay. So just keep holding still like you're doing, breathing deeply. Okay. All right. Okay. Okay. Okay, I don't feel any edema. Very good. Okay. All right, just checking along this ankle area. Can you gently lift your one foot? Okay, good. All right, why don't you lift the other leg too? Okay, good. So it seems like your mobility is most likely intact. We'll know for sure when we get you up walking. You may be needing a wheelchair for a couple weeks just because of the air particles on this planet. It's very, very sensitive to mobility in the human species. So, but everything feels good. Okay. Okay. Just. I'm coming here to this area. Okay. Can you? Okay. So can you take your foot and at the tops of your toes try to reach your body like this? Yes, good. So flex for me. Okay, good. Now stop and relax. Okay. Okay, your muscles feel very normal and reactive. Here, let's do it again on this side. Okay. Okay. Excellent. Okay. Very good. I'm going to run a quick Babinski test just to make sure that your feet are reactive and reflexive. Very good. Okay. Okay. That's very good. That's excellent. All right. I want to say that you actually have been approved. Okay. We have found no contamination from the other planet on you. What I would like to do is just kind of chastise you for endangering Earth by trying to go to another planet. You're here with us. This is a beautiful planet, and we want you to stay here. Okay? So, whatever you need to do to make things better for yourself, go ahead and do it. I hope that this exam has helped you. Okay? And welcome back to planet Earth. We hope you stay a while this